In honor of Pink Ribbon Month, the next few episodes of the St. Louis Pain Expert podcast will be dedicated to breast health. And on today's episode, I have with me April Abbonizio, owner of Midwest Thermography Solutions. And she's going to be talking to us about the use of thermography for early detection of breast cancer. Wherever you're listening to this podcast, don't forget to hit the subscribe button so you get notified of our next couple episodes about breast health. And if you have struggled with breast cancer, either personally or know someone who has, our thoughts and prayers will be with you all this month. Stay tuned and enjoy the episode.
Listening to the St. Louis Pain Expert podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Listening to the St. Louis Pain Expert podcast. I'm your host, Dr. Dave Candy. I have with me here today April Abbonizio, owner of Midwest Thermography Solutions in Town and Country, Missouri, a suburb right here in St. Louis. And April has been doing thermography for several years, and I'm going to let her introduce herself and tell us a little bit about her business and what she does, and then we'll learn a little bit more about thermography, and with it being Pink Ribbon Month, specifically how it can be used for early detection of breast cancer and other types of cancer. So April, thank you for joining us today.
Thank you for having me. Yeah, I got into thermography about 6 years ago. I found it because I was just at that age where my doctor was, wanting me to have a mammogram. And the more I researched mammography, the less impressed I was with it. And there's a lot of radiation that comes out of a mammogram, and they're asking women to do this every year. It's ionized radiation, and we all know that radiation can cause cancer. So if you're getting radiated consistently in one little area, studies have shown that after a certain amount of time, the small tumors will grow, and they think it's caused from the radiation. So that was a concern. The compression is a concern, 40 to 50 pounds of pressure on, soft tissue is not really healthy on any area of your body, really. So I just was seeking out a healthier alternative and came across thermography and did my research on thermography and discovered that, there's countries over in Europe that have actually banned mammograms because of the ill side effects, and they solely use thermography and ultrasound. And so the more I researched thermography and the efficacy of it and the safety of it, I was pretty sold on it. And I'm a health coach as well, and had the health and science background. And so I actually looked into purchasing the equipment to start my own business, and was able to because of my background, and been doing it ever since.
That's wonderful. Now, for people who are listening who are unfamiliar with thermography and what it is and how it works, can you kind of just give us the general overview? What can it be used for, and what exactly does it detect?
So thermography is digital infrared thermal imaging. So what it's doing is just using an infrared camera, and that camera is capturing the infrared radiation that's being emitted from our skin. And that infrared radiation that's coming off of our skin, it indicates blood flow patterns. So each of us have a very unique blood flow pattern. It's kind of like a fingerprint. And when that blood flow pattern has abnormal patterns, or it's changing in our bodies, that's when we know something is going on, whether it's inflammation, whether it's lymphatic congestion, whether it's myofascial inflammation, cancer, something's happening. And so it kind of guides you to the areas in your body that need more attention, basically. And it shows things, we're looking at it at a cellular level. So it shows things in the early stages of disease. So you can catch things even before you have symptoms. So you can, when you're targeting something, when you see something and you can, do whatever treatment for that particular issue is, you can actually change the trajectory of that condition or disease because you found it so early. It's not too late. So thermography is like the epitome of early detection. It can be used, it's most well known for breast imaging, but I do total body imaging, and, it can find sinus issues, dental issues, thyroid issues. It's a great stroke screening for carotid artery plaque formation, heart, lung, breast, any organs in our abdominal area, the spleen, kidneys, gallbladder, liver, digestive issues, hormone imbalances, lymphatic congestion, which is huge. I think we're just starting to realize how important lymphatic flow is in our body. So it shows a lot of vascular issues, blood clots, and it's just, it's a wide variety of conditions and diseases that it will pick up.
And I know I initially got interested in talking with you because of its implications for early detection of musculoskeletal problems and finding out where the inflammatory sources of those things may be.
Yes.
Now, you mentioned at the beginning that everyone has sort of a unique pattern, kind of like their own fingerprint on thermography. Is there a benefit to having like a baseline testing so that you know what your norm is, so to speak, and then when you have subsequent testing is something different? Or are there unique things that you can see on the thermography image that you say, hey, that's abnormal in anyone?
Mm-hmm. The baseline is the basis of all further subsequent imaging for thermography. So once you get your baseline, we know what your thermal patterns are, what's normal for you. And then if there are any changes beyond that, we know that something's going on. So yes, it's beneficial to get it, and it's beneficial to get it younger. Like 25 years old is not too early to come in and get your baseline, because cancer disease can happen at any age. So when you come in early, you get your baseline. You don't necessarily have to come every year when you're that young, but when you come back, your thermal patterns should be the same. And if they're not, then we know something's going on.
And like you mentioned before, it is safe if you start mammography in a 25-year-old who's obviously at very low risk for breast cancer at that age. Over the years, that subsequent radiation definitely adds up, even by the time that they are 40. But I guess there's not that risk or not that exposure. What are the risks with mammography?
There are no risks with thermography. It is as safe as taking a picture with your cell phone. I mean, really, it's basically, there's no contact with the patient. So I'm just, I'm several feet away from them, just taking images of whatever body part they want imaged. And there's, so it's non-invasive. There's no contact with the skin. There's no radiation. So there's no ill effect from thermography at all. It's a beautiful thing.
Low side effects are good for any type of test or treatment.
Yes.
Now, how specific can you get with it? If you find something that's abnormal or a change in your thermal patterns, what does that indicate, and what are the next steps after that?
Well, I think it depends on, I don't read the images. I send them off to medical doctors who are board certified in thermology to read them, write up the report. They take health history into considerations, any symptoms the patient has into considerations. They read them and send me back the report. But, I think different patterns can indicate different conditions. And let's just talk about breast right now. Like there may be a pattern for fibrocystic breast, which is very different from the pattern of a tumor, a cancerous tumor. There's a pattern for lymphatic therapy or congestion. I don't know these patterns. I mean, they're literally looking down to the pixel and they're measuring each pixel to the 100th of a degree. So it's very specific, but it doesn't always, it won't diagnose you. They'll guide you to where sometimes the doctors will say it may look like if they have low circulation in the hands, it may look like Raynaud's syndrome. But they won't tell you that it is Raynaud's syndrome. They'll basically say you can get further testing to confirm, but and again, it depends on where it is. Like if their liver looks a little, the patterns look a little abnormal, they won't suggest it's liver cancer or or a congested liver. They just basically said, the liver function is abnormal. So then it just provides you that information where you can go get further testing, and you take that report right to your doctor, or I send reports all the time to doctors. So they have them there, and then they can do further testing based on their report.
Okay, so it sounds like it's a pretty sensitive test, that if there's something abnormal going on, it's not going to miss that many people, but it's not that specific to any one disease or condition that you need to have some more specific medical testing done if something did show up. Is that correct?
Correct. And, many people use it as a preventive measure, basically because when you look at your body at a cellular level, you're finding those changes in the earliest stages of disease that you may not even have symptoms yet, so you're finding, I just had a patient in here the other day that she had some gut issues, and that showed up in thermography, and she wasn't having any symptoms, but when she was tested for stuff, they found, some issues. So she was very thankful for the thermogram and the report, so she could take that to her doctor and then do further testing for that.
And the people that I've seen that have had gut dysfunction or IBS or Crohn's disease or other things like that, a lot of them go on a long time with symptoms before they actually get a diagnosis. It would be great to be able to detect some of those problems before they actually become problems and just head them off at the path. So it sounds like that would be a great use for it.
Absolutely. Yeah, I mean, it's like, I'm going to give you an example. Another patient of mine, thyroid dysfunction showed up on her. She had all her blood work done. Her blood work looked normal. And I said, sometimes you can have nodules on there that don't show up in blood work. So she requested a thyroid ultrasound, and sure enough, 2 nodules. So they're watching the 2 nodules, that wouldn't show up in any other test. And most of the time nodules are benign, but there are cases where they can change and turn malignant. So she was very thankful for that information, so she could get testing beyond the normal blood test to know now that she has a couple nodules that they just watch once a year.
And I imagine you can also follow the changes on that with the thermography images.
Yes, yes, absolutely. Another thing that thermography is really helpful for is watching the progression or degression of a disease. Like if someone has breast cancer and they're undergoing treatment, they come back, in 3 months, every 3 months, I can track whether or not that treatment's working, because we can see by the blood supply, if the blood supply is growing or if it's shrinking. And if it's growing, we know that treatment's not working. And so then they can take that report back to their doctor and do whatever, change it up to a different plan to see if something else will work.
And kind of staying on the topic of breast cancer, you'd mentioned earlier that you use thermography along with ultrasound for detection purposes. How often is it recommended that people get thermography, and how often ultrasound, and how do you use the two in combination to have the best chances of catching things early?
So I honestly, I mean, thermography is recommended annually. And ultrasound is, if people don't want to do mammograms, I myself choose not to do a mammogram. So, but I still feel like you need the structural testing. So I choose to do ultrasound. They just see different things. And so when you combine a physiological test like thermography with a structural test like ultrasound, and some people still do mammograms, and that's fine. I mean, completely their choice. You have to do what you feel comfortable with. But they're all annual recommendations after the age of 40. So personally, I do thermography every year, knowing that there's a 90% sensitivity with it. And I only do ultrasound probably every other year, and that's just my personal plan. But they work well in conjunction with each other. Not one breast test is 100% accurate. There's things that thermography can see that ultrasound and mammograms can't see structurally. There are also, and all of these things are rare, but there's also things that, you can see on mammogram and ultrasound that you can't see on thermography. And again, that is very rare, but it does happen. And I'm going to give you an example. Inflammatory breast cancer. There's no tumor with inflammatory breast cancer. It's basically inflammation. So you take someone and that's very fast growing. You take someone that has inflammatory breast cancer, they get a mammogram, they get an ultrasound, they're not going to see it. We can see it immediately with thermography. That's just how, different tests work. It's a different kind of test. So it's always recommended, the multimodal approach is always recommended. Thermography should be an adjunct to your other testing.
Okay. Now, for people who are in St. Louis, how can they get in touch with you if they were interested in thermography and learning what benefits it could have for them?
Well, my website is midwestthermographysolutions.com. Or they can call 314-882-7529. You can schedule right online. If you go to my website, you can actually schedule an appointment right there. But it has a ton of information about thermography, about the uses of thermography, and my services, what might be right for you. I have a one region. It's usually breast. If people just choose to image the breast, we can do a women's health screening, which is probably beyond breast, my most popular service. That includes your head and neck, your thyroid, extra images of your thyroid, your breast, and your abdominal pelvic area, and your back. And so it gets a lot of everything that a woman is concerned about, it's going to image the reproductive organs and so forth. So, and then there's an upper body, which is basically everything head to pelvis, and then full body. So there's 4 different services, and based on what you want imaged, you can pick a service.
And we'll make sure to get all those links up in the show notes so that they can find you. For people who may be listening to this outside of St. Louis, are there any resources that they can go to learn a little bit more about thermography, or find someone near them that offers a similar type service to you?
Yes. The ACCT, American College of Clinical Thermology, is a great resource. And I believe the website is thermologyonline.com. A ton of research on there, a blog, lots of information. There's actually, you can look up breast clinics. They call them breast clinics, but they image the full body. And it's every Meditherm. I'm through the Meditherm company, which is the biggest thermography company in the world. It's global. And it lists all the Meditherm thermography clinics in the United States listed by state and city.
That's wonderful. I learned a lot of things talking to you today, and I'm sure the listeners learned a lot as well. If there were one or two take-home points that you wanted people to be able to get from this podcast, or one or two things you wanted people to know about thermography, what would those be?
I think the most important point for thermography is it's the epitome of early detection. And I think what most women don't realize is, we'll stick with the breast. A breast tumor, on average, by the time it's seen on a mammogram, has been forming for 8 years. It's just now a big enough structure to be seen on that mammogram. We're looking at it at a cellular level. So we're watching it form. So when cancer tumors double every 90 days. So if you don't catch it early, it could be detrimental. So I feel like the early detection is one of the number one benefits of thermography. Not just breast, but your full body, early detection of any condition or disease. I mean, it literally can, give you quality of life. In the end, if you're catching it early, you can sometimes reverse disease before it's too late, and which in turn gives you better quality of life.
Wonderful. Well, thank you so much for joining us today, and I appreciate it. And I'm sure we'll be in touch in the future.
Thank you, Dave.
Have a great day.
Thanks, you too.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.